So what I do now is I'm trying to kind of just coordinate everything, see what we have out there, because everybody was doing little projects on their own. Some of them were evidence-based practice, some of them were quality projects, and trying to get out there what's the difference between research, evidence-based practice, and a quality improvement project. And then I developed a process, an algorithm for this is exactly what we need to do with all of our EBP projects, so that everybody was on the same page, was going through the same steps, was pulling in the people they needed to pull in, getting the right people involved, and doing the literature reviews correctly, making sure so that when we have an end product, if we have a change that we see from the evidence needs to be done, when we take that to the stakeholders, when we take that to the people who can make that change, we're strong in this is the best thing to do. Dr. Melnick talked this morning about that. There's specific steps to an EBP practice change in an EBP project, and so we use her things and put those into practice as part of this process that we have. One of the big things with that she spoke to too is having evidence-based practice mentors. All of our CNSs at the James have gone through Dr. Melnick's week-long immersion program and are now considered EBP mentors. So whenever we have a new project, I put it out there to them and say, which one of you wants to be the mentor for this? One of the key things in that is to help them to remember this isn't your project, because as CNSs, as nurses, we want to take it on and do it, and we need to encourage the staff nurses to be able to do that and help them along the way rather than just taking that and running with it. And then making sure that we're on track with these things throughout. We have two specific programs. We have a nurse residency program, and as part of that, all of them have to do an EBP project. So I now go and speak to them and do about a half a day on just an intro to EBP, and then we help them figure out what their project's going to be. And we want it to be something that is going to benefit not only them in their knowledge and being able to do that, but it's going to benefit the James too.